In the vast, anonymous corridors of a major hospital, trust is paramount. We place our lives and the lives of our loved ones into the hands of professionals adorned in sterile white. For years, one such professional, Nurse Maria Hamilton, was considered a paragon of dedication, a model employee, dependable, efficient, and outwardly compassionate. But that white coat concealed a horror so profound, it defied imagination. Maria was not a healer. She was a methodical predator, operating within the very walls designed to protect life. Her victims were chosen with chilling calculation: the vulnerable, the elderly, those without family who might delay the notice of their passing. As the night shift settled in, and the hospital hummed with the quiet desperation of illness, Maria would move. She would slip into the room of her chosen victim and administer an impossibly high dose of sedatives. The patients would not wake up. They simply slipped into a deep, final slumber. Under the cover of darkness, Maria began her gruesome ritual. She would transport the body, not to the morgue, but to a secluded utility room, or perhaps a rarely used equipment closet. Using the precise skills learned through years of medical training, she began This was not a chaotic frenzy of violence. This was dissection carried out with surgical precision. She was not destroying her victims. She was preparing them. She consumed their organs, driven by an unimaginable compulsion, and then systematically dealt with the remains. The bones were carefully packaged in sterile containers, disguised to look exactly like biohazardous waste, ready for disposal. The flesh, however, required a different hiding spot. She would conceal it deep within the staff refrigerator, cleverly tucked away among blood bags and medical supplies, a horrifying secret disguised by the routine chaos of hospital life. But the veil of professionalism began to fray. A subtle, unsettling odor, something metallic, something sickeningly sweet, began to permeate the sterile environment. Staff members whispered, initially dismissing it, until the smell became impossible to ignore. Eventually, the police were called. What they discovered was a nightmare made real. On a surgical tray, amidst gleaming instruments, were human remains. And then, they discovered the staff locker, where Maria kept her most chilling possession: a handwritten logbook. This was no ordinary journal. It was a detailed, clinical manual describing the anatomy, the methods of dissection, and the preparation of each victim, documented with the detachment of a surgeon writing a textbook. When confronted with the evidence, with the horror she had perpetrated, Maria Hamilton did not weep, nor did she plead for mercy. She simply offered a cold, satisfied smile, and she gave her terrifying explanation: I just wanted to take care of them until the end.